Anthony. I'd like to say thanks to the Webinar Vet for hosting us tonight, and of course thanks to Whiskers for making this possible. It's really exciting to be able to talk about feline dentistry because I think it has been a slightly neglected part of veterinary dentistry, so it's great that Whiskers are trying to spread the word. So let's crack on. Thank you all for turning up tonight and tuning in. It's great. I heard how many people there are that were registered, which was slightly perturbing, but anyway. This is really exciting, and it's really literally just happening. WikiVet have partnered with Waltham to create some dentistry learning resources that were written by one of my very good friends and colleagues, Lisa Malella, who, as some of you probably know, sadly is no longer able to practice due to motor neuron disease. She's one of my mentors, and actually she's the person really that sort of motivated me to get into this career. So this is going to be a really good resource to sort of use. It's a collaborative project and a big educational database. It's being used by about 300 universities all over the world. And this database is going to have downloadable dental charts that you can use, diagnostic guides, and you can work through all the healthcare modules. And the first one that's sort of being launched is the feline and canine dentistry module, and you can work through anatomy, oral hygiene, surgical procedures, and you can also get access to all of my previous webinars. And the great thing about it is it's a free resource. So there's Lisa. All you need to do is go to this website and then register, and then you can get access to all of this amazing information. So really exciting. Literally it was, I think, went live about an hour ago. So we're pretty much as up to the minute as Twitter at the moment, I think. The next exciting thing that I've been really privileged to be a part of is two clinical practice special editions of the Journal of Feline Medicine and Surgery, both dedicated to feline dentistry, and myself and Elise Robertson, who's a feline specialist, were the guest editors, and it really is going to be an amazing couple of journals with some fantastic articles. Lisa's written an article on feline malocclusion. There'll be articles on dental radiography, extraction techniques, maxillofacial trauma, anesthesia. So it really is going to be a great edition of articles to put on your shelves. If you're a member of ISFM, or the American Association of Feline Practitioners, then you will get free access, and you can go and purchase the journals online at this web address as well. So let's get cracking with cats. This was obviously not a domesticated cat, but I was lucky enough to go to Lisa and treat this tiger. And essentially cats are all very similar, just some are bigger than others. Cats have very specific anatomy, and we see some dental problems are more common in cats than they are in dogs. So for instance, cats seem to get gingival more commonly. They seem to get tooth resorption more commonly than dogs, although I am going to touch on tooth resorption in dogs a little bit both tonight and next week, because people seem to think that it doesn't happen in dogs. Well, it does happen in dogs, and actually if you start looking you can see it quite commonly. Cats also get similar dental problems to dogs, so they get a high prevalence of periodontal disease as well. Tonight I'm going to focus on periodontal disease and tooth resorption. So the first thing that I want to do is to test your anatomy, and everybody's favourite subject is anatomy. So we have a quick poll now, and I would like you all to tell me which this tooth is, the asterisk tooth. It is a cat, I'll tell you that much. And you have several options. So if you could launch the poll, please.
Yeah, I've launched that one, Rachel, so just letting people vote at the moment. So just have a guess. Those of you perhaps who are not familiar with webinars, you should just be able to click on one of those numbers. Rachel, you can't see these at the moment, but obviously I will I'll shout you the numbers as we just let a few more people vote. Another 10 seconds. Those of you not sure, just have a guess. If you can't vote for whatever reason, sometimes one or two obscure tablets may not take to the voting, you can always put your answer in the question box, and so we know that you've had a crack at that. Nearly 3/4 have voted, so I'll read you the numbers out, Rachel. We've got 11% have thought it's 307, 14% have said 306, 36% the left mandibular premolar 1, 34% left mandibular premolar 2, and then 5% left mandibular premolar 3. So 11, 14, 36, 35, 34, and 5% at the end.
Okay, that's quite interesting, quite a spread there. The people that said either A or E were correct, and from the figures I've just written down, that's 16% of you. So 84% of you unfortunately got the answer wrong, and I'm not sort of saying this to try and make you feel ashamed or anything, but it's a common finding that there is a lot of confusion surrounding these teeth, particularly in cats, because of course they have a reduced dentition. And it's very important that we know how to talk about teeth and which tooth is which, because when we're writing our clinical records, we need to be specific. So the Triadan system, or more specifically the modified Triadan system, is a numbering system, and for those of you that were not sure what 307 or 306 means, the Triadan system tries to reduce this confusion. And the way it works, it's a 3-digit number. The first digit tells you which quadrant of the mouth we're in. So the 1 is the right maxilla, the 2s are the left maxilla, the 3s the left mandible, and the 4s the right mandible. And then every tooth is given a 2-digit number, and we start in the midline at the first incisor and we count backwards. So if you look at the photograph on the right maxilla, we would start with the first incisor would be 101, 102, 103. The canines are always tooth 4, so 104, 204, 304, 404. Now the cat doesn't have premolar 1 in the maxilla, so there is no 105, and then we have 106, 107, and 108. The 9s are always the first molar, and hopefully you know that in the cat's maxilla, the largest tooth, the carnassial, is the upper 4th premolar, same as it is in the dog, and the cat has a very small, insignificant molar tooth there in the maxilla, so that would be tooth number 9. And then on the left in the mandible, on the left side, the 3s, again, the numbering is exactly the same. We would start in the midline with the first incisor, 301, 2, 3. The canine is always number 4, so 304 on the left. The cat doesn't have premolar 1 or premolar 2 in the mandible, so we don't have 305 or 306. We then go to 307, 308, and remember the first molar is always tooth 9, and the cat only has 1 molar tooth in the mandible. So it can seem confusing to begin with, but you can pick this up quite quickly. So if we look at the photograph on the right, the tooth that I asterisked at the start is the 3rd premolar, or it would have been 307. So cats' teeth are certainly similar but very different to dogs' teeth. The roots are proportionally much longer and thinner, so they're much more likely to break when we're trying to extract them, particularly if you use inappropriate equipment or an inappropriate technique or force. The lower molar, the first molar there, so on this x-ray, that the tooth on the left-hand side would be the molar. It's got slightly different anatomy. If you look at the other 2 teeth, they're relatively symmetrical, and if we want to extract those teeth, we're going to section them in half, and we would section from the furcation, which is roughly in the middle of the tooth. But if you use the same principle in the molar tooth and try and split it right down the middle, then you won't split the tooth equally into 2 roots and crowns. You'll end up with kind of 1 1/2, and then it will be very difficult to get those roots out. The other thing they can have is a sort of bulbous tip to the root, or a little hook on it, and that can make extractions quite challenging. And without having dental radiography, you may not notice that there's or you won't know that there's a sort of a bulbous tip there, and the tooth will break, and you might think that you've got all of the root out,